The monoclonal antibodies, they were authorized for treatment of mild to moderate COVID symptoms a few months ago. They work really well early on in the disease to help decrease the symptoms and duration of illness. Monoclonal antibodies are made outside of the body and then injected, and then they work to bind to the virus spike protein so that they can't make copies of themselves in our cells. There's three basic criteria. The first would what I would call patient demographics. It would be indicated for adult or pediatric patients, that is 12 years of age or older, who are at high risk for progression to severe COVID-19. The second criteria would be what we call patient vaccination status. And so this can be either a patient who has not been fully vaccinated, and the important term there is fully. For patients who are fully vaccinated but are not expected to mount an adequate immune response, they would be considered eligible. And then the third would be patient exposure. The sooner is always better. But again, I think the concern here would be talk to your healthcare provider to see if they would consider you at higher risk. The monoclonal antibody is absolutely no substitute for vaccination. We cannot administer it for pre-exposure. You can give it through a 30-minute infusion. A new indication for this particular monoclonal antibody is actually you can give it through subcutaneous injection. And so the first initial dose for post-exposure prophylaxis is 4 injections. Our experience has been that the side effects have been very mild.